So we will begin the explanation of the vascular system with the upper and lower venous system. So we will start off with the anterior tibial vein, which is located right here, and it drains the blood from the dorsum of the foot and anterior compartment of the calf. It originates near the tibia at the ankle, and then we look over here at the posterior tibial vein, and that originates from plantar veins of the foot and drains blood from the posterior compartment of the lower leg. And then it receives the peroneal vein, which is right here, and the peroneal vein drains blood from the lateral compartment of the lower leg. So all of these connect up to the tibia peroneal trunk, and that becomes the popliteal vein. And this originates from the confluence of the ATV with posterior and peroneal veins, and that will continue to ascend to become the femoral vein, and this originates at the hiatus of the adductor magnus and ascends through the adductor, otherwise known as Hunter's Canal. And then the deep femoral, or otherwise known as profunda femoris, unites with the femoral vein to form the common femoral vein. And then the common femoral vein lies in the Scarpa's triangle, and it's formed by the confluence of the profunda femoris and the femoral vein, and it also receives that greater saphenous. And it terminates at the level of the inguinal ligament to become the external iliac vein. And then the external iliac vein will connect with the internal iliac vein to become the common iliac vein, and then that will ascend up to the inferior vena cava. So the greater saphenous vein, going back, it originates at the dorsum of the foot, and it ends as it joins the common femoral vein. And then, let's see. Alright, and then we will go over to the venous system in the arms, and we will start that with the deep palmar venous arches that drains the hands from paired radial, which is right here, and the ulnar vein, and that joins to form the brachial vein, which is right here, and that'll join at the antecubital fossa. And the axillary vein begins where the basilic vein joins the brachial vein. So the axillary will join where the basilic joins that brachial vein. And then the subclavian vein is a continuation of that axillary vein. And then the cephalic vein, which is located right here, begins on the thumb side of the dorsum of the hand and joins the axillary, which is right here. It goes up and joins that just underneath the clavicle. And then the basilic vein originates on the small or pinky finger side of the dorsum of the hand, and it enters the brachial veins in the upper arm and becomes the axillary. So it goes up and becomes the brachial, and then goes into the axillary. And then now we will go to the arterial vasculature. So we will start with the arms, and we will start with the deep palmar arch, and the termination of this, the superficial palmar arch terminates in the deep palmar arch, and then the radial artery originates from the brachial artery and travels the lateral side of the forearm. and then the brachial artery originates from the axillary artery and terminates into the radial and ulnar arteries. And then the axillary originates from the subclavian artery and terminates after giving off several branches into the brachial. So it starts with the subclavian, it goes down to the axillary, goes down to the brachial, and then it will split off around that junction and become the ulnar and the radial. And the ulnar and the radial is accompanied by the ulnar and radial bones. So then we will go to the vasculature arterioles of the leg, and we will start out with, the common femoral artery. So it starts with the aorta, and then it becomes the iliac, and it goes down and descends to the common femoral artery, and this originates from the external iliac artery, and it terminates into the femoral artery. And the femoral artery originates from the common femoral artery and runs through the adductor canal, and it enters the popliteal fossa, which that's where it terminates. So the femoral artery terminates into the popliteal artery. And then the deep femoral artery, otherwise known as the profunda femoris artery, originates from the common femoral artery, and then going down to the popliteal artery, it originates from the it originates from the saphenous femoral artery and the adductor hiatus, and terminates as it divides into the anterior and posterior tibial arteries. And then the anterior tibial that originates as the first branch off the popliteal artery and terminates into the dorsalis pedis artery, and the dorsalis pedis originates from the anterior tibial and then terminates into the deep plantar, which is in the foot. And then the posterior tibial is on the posterior medial side of the leg, and then the peroneal, which is right here, travels medial side and supplies structures of the lateral side of the leg and the foot. So now we will talk about two main exams. So I don't really think I can flip the camera over. So first I'm going to talk about the ABIs, the ankle brachial pressure index. I'm just going to turn the camera around and hopefully you can see me well. If not, I'm sorry. So the ABIs are used to access the severity of peripheral vascular disease, which is a stenosis or narrowing of a blood vessel due to atherosclerosis, otherwise known as plaque, in the vessel, and this causes less blood flow. So we do this by taking a blood pressure, which is the systolic reading, in the upper arm and ankle. We take the ankle reading and divide it by the brachial reading to get a ratio. So we have two arteries that we look at around the ankle pressures. There is a posterior tibial artery, which is located at the ankle bone, or the dorsalis pedis artery, which is located at the top of the foot. Once taken the systolic pressures of the PTA and DPA, we will divide the highest of those two ankle pressures by the brachial pressure, and then the interpretation of those results can be signified by these values. So greater than 0.9 or greater than 1, depending on where you look at, is normal, and then 0.6 to 0.9 is mild PVD, 0.3 to 0.6 is moderate to severe PVD, and then less than 0.3 is critical ischemia, which is not good. So that's how we do the ABIs, and now we will talk about doing segmental pressures. So the segmental blood pressure test is one of the most basic non-invasive vascular tests. It is used to measure limb blood pressures at different levels in order to roughly estimate a level of arterial occlusion in patients with peripheral arterial diseases. So you will start with the patient laying supine so you can eliminate hydrostatic pressure. There is a total of 10 blood pressure cuffs. So that will be used on the patient. There are 2 measurements of how wide the cuffs are, and which is 10 centimeters and 12 centimeters. You will place the 10 centimeters on the brachial. You'll place it on the brachial. You'll place it on the lower calf, and let's see, you will place the 10 centimeters on the left and right arms in the brachial area, and a total of 4 10 centimeter cuffs on the upper and lower calves, 2 on the left and 2 on the right. You will use a total of 4 12 centimeter cuffs on the upper and lower thigh, 2 on the left and 2 on the right as well. The machine at the beginning of the test will ask patient name, patient ID, patient sex, patient date of birth, and user ID. When attaching the tubes to the blood pressure cuff, you want to make sure that each tube is correctly placed, so when the blood pressure cuff is inflated, it will inflate the correct one. So once you start the exam, the machine will tell you what cuff it'll inflate at the top of the screen, so you'll want to pay attention to what it says and follow along with that so you get accurate results. So you will simply click inflate. Once the cuff starts to deflate after cutting off the waveform, the turning waveform will begin. The goal is to see 3 equal waveforms at the same height of the screen. Once you see this, you will click capture, and you will complete the same method for each cuff. Once the machine asks for a brachial pressure, you will then start to use your probe. Your goal is to find a well-sounded signal, then inflate until the vessel is occluded. You will then click deflate, and you will then listen for the signal to come back. Once you hear the signal to come back, you will click capture, and you will then use the scroll back button to the very first signal heard and basically straddle the peak of that signal at the very far right of the screen. So this will give you a pressure, and once satisfied, you will click next. Once you take the arm pressures, you will begin with an ankle pressure beginning at the dorsalis pedis artery, which is located at the top of the foot. You will complete the above stated method and click next. Once you have taken the DPA, you will take another ankle pressure at the posterior tibial artery, which is located at the ankle bone. You'll want to pay attention to the DPA and PTA pressures, because whichever pressure is the highest, that's the ones you're going to use for the rest of the limb. So you will perform the right PTA and DPA separately from the results of the left PTA and DPA. So if the left PTA is higher than the DPA, and then the right DPA is lower than the PTA, you'll go accordingly to separate legs. You will continue to get pressure for the calf and upper thighs according to the higher DPA or PTA pressure at the ankle. That's what I just stated. This will be used on both legs, and it is important to go according to the directions given at the top of the screen to eliminate inaccurate results as stated before. That is very important. If at any time you think that you don't have accurate pressures, you can always do it over. So when you are done completing everything that the machine asks, getting all of those pressures and the graphs and stuff like that, you will print your results and send it to the reading physician, and that is how you perform segmental pressure exams.